May is a time to raise awareness of those living with mental and behavioral health issues. And here every week on WSFL TV, we are going to fight the stigma so many experience.
Because of the intense isolation and not really being able to interact like I used to, I think what really happened was like my mental health definitely fluctuated. I would have
Benjamin McAfee was diagnosed with
experiences
bipolar
of
disorder in
just
college. The
suicidal
pandemic
ideation.
intensified Benjamin's emotions as the closure of his school isolated him from friends, resources, and a familiar routine.
I would have experiences of just suicidal ideation, but at the same time, I could also have experiences of being extremely hyperactive, being manic.
He's not alone. A recent survey conducted by the Centers for Disease Control and Prevention shows 63% of 18 to 24-year-olds reported symptoms of anxiety or depression over the past year, with 25% acknowledging increased substance use to deal with that stress, and 25% saying they seriously had considered suicide. Across the country, suicides prevention hotlines throughout the pandemic have reported an increase in phone calls. The Crisis Text Line, a free service that helps people in crisis, reported that in Florida, conversation volume went up 25% from the year before.
Statistics are showing that alcohol use, illicit drug use, mood issues such as depression and anxiety are really kind of through the roof. And I've been seeing that as well.
Dr. Bo Nelson with FHE Health says for those who are struggling with symptoms of anxiety or depression, it's important to seek for help right away, especially individuals who've already been diagnosed with a mental illness.
Whether it's young people, adults, or older adults, each one of us is really facing a lot. So in this situation, we're seeing patients who might have otherwise been managing their symptoms, or maybe they were kind of getting by, have a couple of bad days or something. They're noticing that they're more severe. And so, of course, with that, you want to be able to connect with your support systems and professionals as needed so you can better manage, just like any other health condition, your mental health.
Many people are going through this, and like having that support and having those resources is really going to get you through this, because at the end of the day, you can't really deal with these issues or go at this alone.
There are numerous hotlines to call for help for those in a crisis, but if you feel you're at an emergency stage, call 911. NAMI Broward holds various support groups and virtual events. For resources and more information, head to our website, WSFLTV.com. You'll find this story right on our homepage. Melissa Marrero, WSFL TV.